Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk to about today is specifically about the neck. The neck is more commonly in the medical world referred to as the cervical spine. And hopefully you can see this picture here on my screen. It goes from about roughly your collarbone area, roughly, and then extends up all the way to the base of your skull, so the back of your skull. Um, so we're going to talk briefly about the bone structure, just the general anatomy, some muscle attachments, because there are many, many, many different muscles that attach to the neck. A lot of them are small, but they all serve a purpose. And if one's a little bit tighter than the other, or one is damaged, it can lead to some issues farther down the chain of your body. And then we'll talk a little bit about the nerves, but not so much about the nerves today. But this is a picture. This is basically your back view of the head. This is the back of the skull. There's seven cervical vertebrae. So there's seven stacked vertebrae. There's little discs in between each to provide structure and stability, and to provide enough room for these nerve roots to come out. It's this right here. This picture has been cut away at the top here, but there's seven stacked vertebrae. And you can actually feel, if you're feeling down the back of your neck in the middle, you'll feel a point. That's sort of the bottom of the cervical vertebra. Is if you put a little bit of pressure and come to the point, that's really the bottom of your cervical vertebra. But as you can see, your spinal cord travels down through your vertebra and is supported by the structure of the bones. And each side, there's nerves coming out. And these nerves supply sensory pathways for your skin, for some other sensory organs in your body, but they also provide nerve pathways for motor action, meaning that muscle movements, head movement, lots of different things. So this is just the basic structure. Right at the base of your neck, there's an interaction between the top cervical vertebra, which is called the atlas, which is C1, and the very base of your skull. There's essentially like a rounded interaction between the base of your skull and the top of the C1, the cervical vertebra, and that allows for your skull to do different movements. It's a cartilage articulation there. Interacting with the atlas is something called the axis, which is on C2. And it's actually like a little peg in a ring structure that allows for more rotational movements. This is very, very important because if either of these are damaged, and it does happen, unfortunately, they can cause major structural changes and there's a lot of sensitive structures here, particularly right at the base of the skull where C1 and C2 are. Damage can lead to some very serious consequences, sometimes even death. It doesn't happen often, but occasionally it happens. So that's why these structures, the first cervical vertebra and the second, are very, very important. Luckily, our anatomy, we're built with a lot of muscular structures protecting a lot of this stuff. So unless you had a major traumatic injury or something, you're not likely to damage some of this stuff. So no cause for concern, but just something to know about and consider. So this next picture is a side view. So you can see the atlas, which is C1, it inter-articulates with the bottom of the skull here. And then the axis, you can't see it, but there's a little bony structure that these two integrate on one another and allow it to move fluidly, so you can do up and down and side to side movements. And this is C7, that's the bottom one. the bump that you can feel all the way in the back is the spinous process, and C7 is that bottom bump, the spinous process of C7. Again, these are muscular attachment points. You also have going out laterally transverse processes, which are also muscular attachment points. But what I'd like to illustrate here is this person has good upright alignment. There's enough room for the spinal cord and the brainstem up here to travel through to allow good pathway. And you naturally have a little bit of a concave curve to your cervical spine. So let's move on. We talked about the anatomy of the bones. Let's talk about the muscles, because as you can see, there are lots of different muscular attachments, and a lot of these muscles are very small, but they have particular and important interactions. So this would be a frontal view. This would be right here. If you were to peel away this layer of skin, and actually there's another muscle on top, but these are the muscles that run along the front here. These are very important because they're more postural stability muscles. These are your deep neck flexors. And if you don't have good strength of these, you can't maintain good upright position of your head, because their job is to keep good upright alignment. If they're weak, you end up in a shrunken, flexed posturing. Let me turn to the side here. So strong deep neck flexors would be good at keeping you upright, keeping your head and your neck in good alignment. As these weaken, you tend to end up with more of a forward head posturing. So hopefully you can appreciate that in my picture. There's different strategies to strengthen these. I'm not going to talk necessarily about that in this. This is more of an anatomy lesson, but in the future, I'll talk about some deep neck flexor exercises to do. Again, these are very important postural control muscles. They're kind of along the sides here. There's actually another layer that's kind of on top of this, but in humans, it's not necessarily functionally important. In some other animals, it is. This is more of a side view, as you can see. There's some important muscles here. The main two that I want to talk about is this big one called sternocleidomastoid. And it goes from, there's a pointy part up here on the side of your head called the mastoid process, and then your sternum and your clavicle. So hence the name sternocleidomastoid. So it just talks about the attachment points. But this is a very important stability and mobility muscle, important for moving, rotation of the head, movements, control. And what I find a lot of times happens, some of my patients in physical therapy who have lost mobility of their neck, sometimes you can even see that this muscle is so tight that it's restricting movement. You can, without even, the word is palpating, but without even feeling the muscle, so on some people, you can visually see that that muscle band is so tight that it's really restricting their movement and keeping them more in a different posture. So that's this big one right here, sternocleidomastoid. There's another muscle group that I want to talk about. I'm not necessarily going to talk about the specific muscles, and it doesn't necessarily interact with the spine, but it is important to talk about this. There's actually a bone here called the hyoid bone. There's a couple of functions of the hyoid bone, but one of the main functions is it serves as an anchoring point for the muscles of the tongue, but also serves as a cartilage deposit right here for structure, for fluidity of movement, and for protection. So I'm not going to go really into depth with that, but as you can see, there's an interaction between the skull, between the jawline, and between the clavicle, which, if you have a muscle imbalance, can lead to different muscle tightness, which can then impact the spine. So that's the hyoid bone. It's a small bone. You can't really, even tell it's there unless you know what you're looking for. Um, so this is another cutaway of the deep neck flexor muscles. So hopefully you can. The other picture I showed didn't really have any context as far as the skull and where you were at in the body. So this picture provides a little bit of context. These are the same deep neck flexor muscles that are important for keeping good upright posture and alignment. So as you can see, this is the front of the face, and they run basically along the front of the spine. And this is another picture of the sternocleidomastoid. The mastoid process is here on the skull, and there's the sternum here in the chest, and then there's the clavicle here on the shoulder. Well, sort of the shoulder, it's more frontal, but your clavicle does attach to your shoulder. These are very important mobility and postural control muscles. Lots of muscles. Okay, so moving on. In the back of your head, so again, we're going to the back of the spine. So this would be, if this picture, these muscles were overlaid on top of this picture. So right here. So you can appreciate, this is the back of the skull, the back of the head, and right as you can actually slide down. So if you there's a bony point on the back of your head, and if you slide down a couple inches, there's a little bit of a valley, and in that valley is where these muscles lie. These are called the suboccipital muscles. Unfortunately, a lot of times these muscles can get tight and they can get overworked, leading to reduced mobility and compression of some very important structures, meaning some of these nerves that are coming out. It also can have an impact on your skull alignment with your bones. So you might be a little more tight and stressed back here. You might have some local pain or discomfort in the back of your neck at the very, very top. And sometimes it can be one of these little muscles that are at play. They're very small. They're only maybe about 2 inches, 3 inches in size. But they attach to some very, very important bony structures that we talked about earlier in here. And they have a tendency to get tight and overworked. So these are your suboccipital muscles. And a lot of times you can relieve neck pain, particularly at the top of your neck, by just different positions or stretching these out by applying a little bit of focal pressure. I said I was not going to go into treatments, but applying a little bit of focal pressure, like laying on a towel roll that's bunched up real tight, something to allow these to stretch out and to allow gravity to just have an effect, to stretch some of these little muscles, particularly the ones that are going vertically versus laterally, although the lateral ones do have an impact on your mobility. But these are the suboccipital muscles. The reason they're called that is because this area in the back is the occiput. There's the occipital bone, which is all these bones are fused together, and they don't have a good job of showing the sutures on this. But these muscle groups lay right on top of all of this right here. And these are some very, very sensitive structures. You've got nerves coming out, and you've got your brain stem, which is vital organ function and very, very sensitive organ control and nucleus groups for your brain and your spinal cord. So these muscles, particularly these little muscles, are very, very important. So that's about all I want to talk to you about today. Let me review real fast. I'll review backwards. These are the suboccipital muscles. A lot of times these little tiny muscles can get tight and can do a lot of, not necessarily damage, but cause a lot of discomfort. But thankfully, a lot of times the discomfort can be relieved by just positioning, stretching, and being more conscious of posture. The muscles attaching, this is the sternocleidomastoid. It's it attaches from the sternum to the clavicle and the mastoid process. And this is an important muscle in stability and mobility. If this muscle has an imbalance or is tight, it can cause some neck discomfort and even some shoulder discomfort sometimes. Moving forward, these are the deep neck flexor muscles. They're running along the front here. And these are very important postural control muscles. If you're weak, you can have more of a forward head posturing and be a little slumped over, versus if these muscles are stronger, they're better at righting your cervical spine to maintain upright position. Again, this is another picture of the sternocleidomastoid. Hopefully, I'm doing a good job of illustrating how if the muscles that are not even attached to the spine are tight, they can pull on the skull and pull on the shoulders, which then in turn can cause some spine discomfort. So it's important to have good posture and good muscle balances, even the muscles that don't attach it to the spine at all. Again, this is another picture of the deep neck flexor muscles. So the same as this one. This picture just has more context of where it is in relation to your head and your skull. But these muscles, as you can see, have a very, very close association with the spine, the front of the spine. They're attached to each one of these vertebrae on the front, and they're very important postural control muscles. So those are the deep neck flexor muscles. Reviewing in reverse, you've got 7 cervical vertebrae, which are the bony structures stacked on top of each other. And this picture does a good job of showing the discs in between. The discs and the bones in the neck are particularly small. They're relatively small. There's a couple reasons. One, for mobility, but also your skull is heavy, but it's not too heavy. So unlike your low back, where it has to support the weight of your skull, your neck, your trunk, your arms, your vital organs, everything, these bones don't have to support quite as much. So they can be more nimble, smaller, to support your skull and all the structures. But you've got 7, and the very, very bottom one, C7, the spinous process. These are muscle attachments, but the spinous process you can actually feel if you run your hand down the back and there's a ridge and there's a big bump at the bottom. That bump is C7. That's the bottom of the cervical vertebra, the neck. And then you can see here there's the axis and the atlas, which articulate and move on each other. And then the interaction between C1, the atlas, on the skull. This is an actual joint that allows for movement of your head. And then moving backwards, you've got 7 vertebrae. Between the vertebra, your spinal cord runs. Your brainstem, which your brain's up here, it becomes your brainstem and then goes through your spinal cord, and you've got nerves coming out either side. These nerves are very, very sensitive, and like I said, some of these muscle imbalances can impact your posture, particularly some of these, and they can put pressure on these nerves coming out, or they can also pull on some of these bony processes and provide compression to these sensitive nerve structures, leading to pain. That's it. Today is just a general overview of the anatomy, including the bone, the muscle structure of the cervical spine, the neck, and how some muscle imbalances can really lead to some discomfort. And in particular, if the neck is compromised in certain areas, you can push on some sensitive and vital structures here up at the top of the spine. So posture is really important, making sure you have good upright posture, good stretching of the muscles so that they have enough laxity and elasticity to move, but also that they're strong enough to support your posture. Again, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village. This is a continuing series on back care and maintenance. In the future, I'll talk a little bit more about the actual recommendations and things you can do for the cervical spine, the neck. But this is just a general overview of the anatomy and some of the other structures. Thank you.